This video does not show the initial steps performed before starting a dialysis treatment, but are important to mention. So before cannulation, wash both hands for about a minute with antibacterial soap. After that, do the same on the fistula area and then dry it with paper towel. Use paper towel because it is less likely to contain bacteria or germs. If a regular towel is used, then it's more likely to find bacteria. Once that has been done, put iodine on the fistula axis. If the fistula has been used for a while, pour iodine on top of the axis and squeeze iodine on the little holes. Right after, clean it up with alcohol. Ensure to clean the iodine or it will produce a burn sensation after a few hours. As shown, the needle has a cap on top, which is used to remove the scar tissue. The scar tissue has to be carefully removed. If a small piece is left, it can get stuck in the blood flow of the needle, and then the cycler, the dialysis machine, starts producing many alarms. Then proceed to cannulation using the needle size prescribed by your dialysis center nurse. In this case, size 15 needles are used. The fistula has buttonhole type axis, therefore, buttonhole needles must be used. Regular needles cannot be used with buttonhole axis because it can damage the tunnel created for buttonhole axis. The needle insertion has to be done using a 45 angle following the direction of the fistula. The same approach must be followed every time a dialysis treatment is done. Buttonhole needles do not have a sharp end. They are stunt needles. Therefore, they must be pushed harder to penetrate the skin, and this is the reason why the tunnel pad must be used all times. If the buttonhole needle is not properly aligned with the tunnel pad, the needle does not penetrate the skin. It does not matter how hard it is pushed. Here, the procedure to find the pad is being used. The needle is pushed in little by little to ensure the pad to the fistula is correct. If a lot of resistance is observed, then change the angle with very small variations as shown in the video. After the cannulation is completed, observe how the blood flow palpitations are seen on the needle holes. This is a good sign that the cannulation was successfully executed. Next, a small support made of tape and gauze is used under the needle to keep right angle during the dialysis treatment. This is not necessary for all cases, but for the fistula location is used. Otherwise, an alarm is produced on the cycler due to high arterial pressure, machine arterial pressure. Cover the axis and the needle with tape and secure the position and angle at the same time. Repeat the same process for the venous axis. When performing cannulation, always start with the arterial axis first and then with the venous axis. Have all the pieces of tapes properly cut and available for using during the cannulation process. Remove the elastic band from the arm. It is no longer needed, and then open the cap to allow the blood to move and fill the entire hose. After that, connect a 10 milliliter syringe with Harappan. Use the dosage prescribed by your doctor. In this case, a 2.2 cc is used. Before the syringe is connected, ensure that the clamp is closed, otherwise the blood will have no way to stop and a big mess will occur. Harappan must be applied on the venous axis after a basic checking for blood clotting. If the blood does not fill up the hose's needle quickly, or not blood is observed, then proceed to attach the 10 milliliter syringe and gently pull up until the first 4 milliliters are filled up with blood and then clamp it. Dispose the syringe and attach a new one to the needle's hose end and pull the blood up into the syringe and down into the bloodstream at least 3 times. If no resistance is observed, then the axis is free of clothing. This procedure is also needed to check if the needle was properly inserted in the fistula axis. If pressure is observed when pulling up and pushing into the bloodstream, then the needle is touching the fistula wall. In these cases, follow your dialysis center nurse recommendations. Not for all cases, but most of the times, flipping over the needle solves the problem. But if the pressure still remains, then the needle insertion or cannulation must be repeated using different angles. By experience, using the proper insertion angle 45 degrees and touching the fistula before cannulation is the best practice. Sometimes the fistula vein moves if the elastic band is not properly placed. Therefore, make sure to properly place it before cannulation. Feel the fistula relative direction from the fistula access points. The little hose attached to the needle has to be filled up with blood up to the bottom part of the cap. Avoid empty spaces because these spaces are filled up with air bubbles, and when the hose terminal is attached to the dialysis machine, those bubbles go into the bloodstream in the body, and if too much bubbles are present in the hose, can cause serious complication with the heart function. The next step is to connect to the dialysis machine. Both fistula access points, venous and arterial, must be connected. Never touch the end of the red or blue hoses to avoid germs or bacteria to go into the bloodstream. As an aseptic technique, attach 2 10 milliliter syringes to both hoses ends on the dialysis machine to prevent microorganisms to settle there, because when the treatment is completed, the red hose is used to return the blood remaining in the dialysis machine into the body, and if bacteria is present in the hoses end, then an infection can occur as a result of improper hygiene. Continue with the dialysis treatment. Never sleep during treatments. It is very dangerous. Always place the white clamps reachable in case too much fluids are removed from the body and extra fluid is needed. By personal experience, this precaution process is done every day. A few times, the saline solution had to be used to compensate the hypotension observed due to too much fluid removed during the dialysis treatment. It is not easy to keep track of the dry weight because without kidneys, the process of calculating the dry weight is always an approximation, and if for some reason the calculation fails and too much fluids are removed, the hypotension occurs. Symptoms of hypotension are sweating, fatigue, weakness, and low pressure with high blood pulse. The result of severe hypotension can lead to fate. This is the reason why blood pressure and pulse must be monitored every 30 minutes during dialysis. When too much fluids are removed from the body, the blood pressure decreases, but the heart has to compensate the lack of fluids and pumps the blood at a faster rate, and this is the reason why blood pulse goes up during hypotension periods. Also, fade is due to lack of blood in the brain, and this is the reason why, before passing out, vision becomes blurred. Hypotension occurs more often than anybody can think, so be ready and prepared. Take all precautionary measures. One extremely important precautionary measure would be to never do home dialysis alone. There always has to be the care partner at home. It does not matter if the care partner is in another room at all the time. But when the emergency occurs, the care partner must always be available to help. Follow all aseptic procedures such as wearing gloves and mask during cannulation, when removing the needles after treatment. Use hand sanitizer all the time when preparing the dialysis machine and during treatment, and dialysis will be an easy thing to do. The rest of the video has been made with the sole purpose to show how I exit the dialysis treatment. I hope you have enjoyed my video. Please share your thoughts on the comment section. Any feedback, whether bad or good, will be taken into account. Thank you.